nucleic acid, right? Nucleic acid. Into the nucleic acid, there is two type of nitrogen base. One is purine and another one is purine and another one is a pyrimidine, right? Purine basically contains with the adenine and guanine, and pyrimidine contains with the cytosine, thymine, and uracil, right? So that uric acid basically released from the purine unit. Whenever the purine become breakdown, then one type of waste product is released that is called uric acid. Understood? So that how the uric acid formation are occurring? Uric acid formation are occurring by the breakdown of the purine. Purine, from where we are getting the purine? Purine we are getting from from the nucleic acid, right? Nucleic acid. So that this uric acid is one type of waste product that should be extractable product, that should be extract out. But whenever this kinds of uric acid become elevated into our body, then it basically causes the arthritis as well as joint pain as well as various type of another type of disorder. Understood?
Yes.
Up to this much, any doubt? Up to this much, any kinds of doubt?
No, no.
Okay, okay. So that we have understood that what is uric acid, right? Now we have to understand that from where we are getting which substance are found in food, drink like liver, anchovies, mackerels, dried beans, beer, wine. From there, we are getting the uric acid. Okay, most of the uric acid are dissolved in blood, and some are passed by the kidney and leaves your body by urine. Basically, these kinds of filtered things basically founded in urine, right? Because that should be filtered out by the kidney. And why it's filtered? Because that is the waste product, and uric acid is the waste product. Getting my point? So that should be extractable product. If it's not extracted properly, then we might say that our kidney are not working properly. As well as whenever these kinds of uric acid diet become increases, or you are intaking the food grains which have lots of uric acid, then the uric acid level become elevated. And whenever these kinds of uric acid become elevated, they may cause lots of complication, lots of problem into our body. Understood? Up to this much understood? That is the basic things about the uric acid. Understood? Up to this much? Any problem? Up to this much? Say me, everyone understood?
বলছি স্যার ইউরিক অ্যাসিড কোথা থেকে উৎপন্ন হয়?
Purine breakdown. After purine breakdown, purine means nucleic acid. Nucleic acid, there is a fraction that is called purine, adenine, guanine. And this purine become breakdown to form the uric acid. Understood? Okay. Anyone have any questions? Up to this much? Any kinds of doubt? Anyone? No. Okay. See, now we are understanding. See here how it's occurring. See, ingested nucleic acid tissue destruction. Tissue destruction means tissue become destructed, and these tissue are contain the nucleic acid. Getting my point? This nucleic acid are break down to form purine, and purine, that is adenine and guanine. This purine are form uric acid. This uric acid should be extracted out by the kidney. Okay, in urine. Getting my point? Into the GI tract, it basically causes the uric acid plus bacterial enzyme and causes the another type of disorder. And these kinds of formation, or that is a phenomena to forming the uric acid. Getting my point? This nucleic acid become breakdown to form purine. This purine are breakdown to form uric acid. So that any kinds of competitive exam or any from any kinds of interviews or questions, you might face that uric acid are formed from, then you have to say that purine. Getting my point? Then you have to say that purine. Okay, now we have to understand that what are the purpose of uric acid. After that we will understand the principle as well as we will understand the procedure. After that, we will understand the clinical significance. Okay, now we are understanding the purpose. Why we will do the uric acid? Okay, see here, uric acid basically we are doing the test of uric acid to identifying the gut. See, if you are seeing here, gut is a form of arthritis where the certain severe pain, redness, and tenderness in joint. Certain types of pain or tenderness are happening, as well as redness are happening into the joint. High level of uric acid can lead the ureate crystal in the joint, causing the gut. See here, whenever, please keep in mind that arthritis is one type of autoimmune disease. Now, what is autoimmune disease? Autoimmune disease is one type of disease which is caused by the our body own self. Understood? Autoimmune disease defining that whenever our body are diagnosis the antigen which is present into our body seems that that is foreign antigen. See, if I am just drawing here, see, our body's immune system is looking like that. But whenever any times our immune system are diagnosis that our self antigen, yes, self antigen, the immune system are diagnosis that our immune system seems that these self antigen are foreign. They are thinking that that is foreign, so that this immune system are causing the antibody against this self antigen antibody, so that antigen antibody reaction should be occurred and destroying the particular substance or particular tissue. That is called arthritis. Getting my point? That is called arthritis, or that is called autoimmune disorder. Arthritis, tis, itis defining that the inflammation. Okay, and arthras defining that joint. A for arthros, arthros defining the joint, and arthritis defining that the inflammation of joint. And how it's happening? It's basically happening by the autoimmune disorder, where basically does not require any kinds of bacteria, fungus, virus. Here basically autoimmune disorder is defining that our body are creating the antibody against our own antigen, so that the autoimmune disorder might be occurred. Auto defining that the self, immune defining that the antigen antibody, these what are defining that that is not proper. Getting my point properly? Getting my point properly? Understood? Understood? That is called arthritis. Getting my point? And whenever sometimes this urate crystal are present into the joint and causing the gut. Okay, and that is the pain in joint. You have seen lots of time into your surroundings, into your village, or into your complete surroundings. You might see that many of people, or many of people above 40 are suffering these kinds of arthritis or these kinds of gut. Understood? They are saying that we have some kinds of disorder related to the joint. We have the joint pain. We cannot doing our daily basis work. We cannot move properly. We cannot sit properly. You might see, as well as you might listen that that's all our arthritis. One type of biggest reason of arthritis is high level of uric acid. And whenever you will see these kinds of arthritis patient, you might see that their uric acid level should be high. Understood? Up to this much, any doubt? Up to this much, any kinds of doubt? Everyone understood? Everyone, please say understood.
Yes.
Okay. Any questions up to this much? Any questions? I think no. Gore? Okay. See, now we are understanding the monitoring the God treatment. Means whenever you are listening the terminology arthritis, or you are seeing surrounding your family as well as surrounding your village, you will see that the arthritis are not developing within one day. Getting my point? as well as this treatment are not happening within one day. Some kinds of medication whenever you are in checking that that might reduces, but it is not the permanent solution. Okay, and you have to monitor the gut, or as well as you have to monitor the arthritis. And whenever the uric acid become low, then you might say that it's a good in nature. Okay, and whenever you will see that this level are not decreases properly, then you can say that, or we can understand that the gut are as well as arthritis are not treating properly as well as not preventing properly. Okay. Second one is the monitoring the arthritis or gut treatment. Third one is the diagnosis the kidney stone. One thing please keep in mind that should be extracted out by kidney, yes or no? So that if the kidney are not working properly, uric acid level increases or decreases. Same. When the kidney are not working properly, then uric acid level become increases or decreases. Same. First, uric acid level
Increases.
Increase.
increase or decrease. So if
Yes, sir.
increase or decrease,
Increase, sir.
why increase? Why increase? So, uric acid is good for our body or waste product. Same.
I
Is it
think
good product or waste product?
Waste
yeah, it's
products, sir.
waste product, sir.
Waste product. So that waste product should be extracted out by which organ? Waste
Kidney.
Kidney, sir.
kidney. Very good. So that if the kidney are not working properly, then waste product become increases. Yes or no? And
Yes, sir.
same to another waste product name, whatever I have already explained into your classes. Besides or rather than this uric acid, same. Another two name. Another two waste product.
Urea.
Urea,
Urea
very good.
and creatinine.
Creatinine. We have already understood, right? So that we have designed the
Yes, sir.
syllabus like that. And today we will understand about the uric acid, right? It is also waste product. Okay. So that same in the previous class we have understood that how the urea formation are occurring. Breakdown of which molecule? Urea formation. Breakdown of protein, right? Breakdown of protein. Urea formation. And creatinine formation. How happening? Creatinine formation. Same. Fast. Creatinine formation are occurring by destroying or by breakdown of which product? By breakdown of which molecule? By breakdown of which molecule? Creatinine are forming. Are you remembering these things? Creatine phosphate. Are you remembering these things? Creatine phosphate. This creatine phosphate are breaking down to form the creatinine. Yes or no? And this creatinine is the waste product. We have understood, right? Okay. See here, accessing the kidney function so that uric acid test basically help to understand our kidney are doing its function properly or not. Understood? Kidney help to filter the uric acid from the blood. High level might be indicate that kidney function are not happening properly or kidney related disorder. Understood? After that, say identifying the cause of recurrent kidney stone. Kidney stone means whenever the stone formation are happening due to lack of water, some kinds of crystal forming as well as some kinds of molecule are attached to form these kinds of stone. And this stone whenever elevated into our kidney, then our kidney are not working properly. Nowadays, if you are noticing into your surroundings, 70% patient are suffering in gallbladder stone as well as another type of stone, kidney stone. If you are noticing the things, everyone almost 60 to 70% patient are suffering in kidney stone and gallbladder stone. Getting my point? And this stone basically happening by the lack of water as well as lack of the proper metabolism. So that these kinds of crystal formation are happening into our body, and whenever it's happening, then then our kidney are not working properly, and then uric acid or extractable product become increases into our body. Understood? So that we have understood the five purpose. Firstly, to diagnose the arthritis. Secondly, to diagnosis the treatment of arthritis of gut. Thirdly, we have understood that to diagnosis the kidney stone. Fourthly, we have understood that it basically diagnoses the kidney function. And fifthly, we have understood that any kinds of kidney stone present or not. Getting my point? And so that uric acid test is also under the renal function test. Into the renal function test, we have understood the creatinine, we have understood the urea, as well as uric acid is also under this renal function test. Renal defining the kidney, our kidney are working properly or not. Understood? Up to this much, any kinds of doubt if you are facing, just say me. I wanna solve your doubt. Say me. Up to this much, whatever the purpose we have understood, any kinds of doubt up to this much, the purpose of uric acid, any kinds of doubt, anyone facing any kinds of doubt regarding the purpose of uric acid? Say me. Anyone?
Sir,
Anyone?
sir, introduction time, I can listen properly, sir. Now I am listening, sir.
Toiba, and which part you are facing doubt? Just look down upon the things. Which part you are facing doubt and which point?
No, sir, now I'm just listening the class, sir, now.
Understand. Okay. Basically, uric acid formation, how it's happening, you have listened these things.
Yeah, yes, sir.
Okay. And that is the purpose. We have understood that purpose. Okay. Purpose basically to accessing, to understanding the kidney function properly, to understanding any kinds of kidney stone are present into or not, as well as we have understood any kinds of gut are present or not. We have understood or the diagnosis process as well as the disease treatment process of the particular gut or arthritis. Understood? And that's all are the purpose of to doing the test of uric acid. Okay. And that is the phenomena how it's the uric acid formation are occurring. Up to this much, anyone facing any doubt? Up to this much, anyone facing any kinds of doubt? Everyone understood? Any doubt? Say me fast. I have to move. Say me.
Yeah, yeah, yes, sir.
Okay. Okay. Now I am coming to the principal section. Can anyone say me into the urea which enzyme are required to developing the color into the urea? Which enzyme was required to doing the test? Which enzyme? Anyone? Which enzyme?
Urease.
Urease. Very good. Very good. Urease. Urease. Very good. And uric acid, they are required the uricase. Don't mix up. For glucose, which enzyme is required? For glucose estimation? For glucose estimation, say me first. For glucose estimation, got pot, right? For glucose estimation, got pot. And for uric acid estimation and for urea estimation, we have understood the urease. For uric acid, we have to understand the uricase enzyme. Getting my point? So that if you are noticing here, see here, uric acid plus H2O means uric acid plus H2O, basically with the presence of uricase enzyme, they form the elantoin. Elantoin plus hydrogen peroxide H2O2. This hydrogen peroxide here, this hydrogen peroxide are coming here. This hydrogen peroxide plus 4-amino tryptopyrin plus phenolic compound. Keep in mind that these phenolic compound are giving the color. These phenolic compound are giving the color. This red quinamine dye basically form, and this intensity of the quinamine dye basically denoted the how much uric acid basically present into the particular sample. Please keep in mind that. So that I am just saying the things only for your revision purpose as well as only for your understanding purpose. Just notice here, this uric acid this uric acid plus H2O, that is water, and with the presence of uricase enzyme, they basically form allantoin plus hydrogen peroxide. Understood? And these hydrogen peroxide are coming to the next section. This hydrogen peroxide plus 4-aminotryptopyrin plus phenolic compound. Keep in mind that phenolic compound basically help to developing the color. This red cunamine basically diform. This red cunamine diform, and we are measuring the red cunamine intensity. So that if you are noticing here, this uric acid assay basically a method of Trivedi and Kabas uh, carboxylene, the 3,4-uric acid, okay, oxidized by allantoin by the uricase enzyme, okay, with the production of hydrogen peroxide. So that if you are noticing here, this allantoin formation are occurring and hydrogen peroxide formation are occurring. By which? By the uricase enzyme, okay, and this H2A2 are react with the 4-aminotryptopyrin and see here 4-aminotryptopyrin and phenolic compound, and the with the process of peroxidase they basically form the cunamine dye. So that if you are noticing here which kinds of enzyme is required, there is a two enzyme is required, yes or no? Two enzyme is required. Say me the name of the enzyme which is required into the uric acid testing, or for the formation of the cunamine dye, or for formation of the colored dye, which two enzyme is required? Say me. You are already watching here. Say me which two enzyme is required?
Uricase and
Uricase and
peroxidase.
peroxidase.
Oh, very good. Uricase and peroxidase, right? See, if you are noticing here, so that here is a color compound name is red quinamine dye. Why this color compound are formation? Which is responsible for forming this color compound? Say me. Which is responsible?
Phenolic compound.
Very good. Phenolic compound, right? Phenolic compound or phenol is required. See, another one is the, if you are noticing here, 4-aminotryptopyrin um, and 2,4,6 tribromo 3 hydroxybenzoic acid in the presence. Understood? TBHB enzyme, that acid should be also present into the oxidase. Okay, that acid should be present. Okay, see methodology. So that the methodology should be uricase method. Yes or no? This uricase method, you have to understand that this uricase method is required to doing the urea or uric acid analysis. Uricase, understood? And they are also required the standard. If you are noticing here, see here, standard should be 6 mg per dl. Okay, that is the standard of uricase. And we have understood the creatinine standard was how was 2, right? 2 mg per dl creatinine standard. Okay, creatinine standard 2 mg per dl. What was the normal range of creatinine? Say me, what was the normal range of creatinine? We have understood yesterday. In the previous class, we have understood. What was the normal range of creatinine? Say me first. Creatinine normal range, say me first.
0.7 to 1.4, sir.
Very good, very good. And normal range of urea, say me first.
Sir, 14 to 40, sir.
Very good, 14 to 40. That is the standard normal range, right? Very good, very good, very good, very good. See, so that we have to check, if you are noticing here is the only R2 reagent is required, right? R2. See, so that if you are noticing here, see here, if you are noticing here, black, you have to take R2 reagent, and the composition of R2 reagent is this all. Understood? They all are the composition of uric acid reagent. Okay, and see wavelength is required 500 to 550 nanometer. This wavelength is required, and cuvette is 1 semi light pathway. I have already understood, as well as I have already explained the thing. Understood? This what is the manual procedure, as well as what is the colorimetric procedure of any kinds of assay. You have to just notice here, and you have to changes which kind of relatable things can be changed. Okay, you have to just change here, but the point should be same for every or any kinds of essay. The point should be same. Okay, just see here, wavelength should be 500 to 550 nanometer, and cuvette that is 1 semi per light pathway after the temperature that is 20 to 25 or 37 degrees centigrade. Understood? And zero adjustment again the reagent blank. Semi. Now, what do you mean by reagent blank? Anyone can say? What do you mean by reagent blank? What do you mean by reagent blank? Anyone say first. What do you mean by reagent
It
blank?
is a blank.
Sir, blank means zero set, sir.
Okay, into the reagent blank there should be reagent or not.
No. The reagent should be there,
Yes,
but
yes.
Okay, and into the reagent blank how much amount of distilled water should be added?
then
500
Same
microns, sir.
same same equivalent, same amount of water we have to add it, same with sample. The sample quantity and the distilled water quantity should be same. If it's 10 microliter, then 10 microliter. If it's 20, then it should be also 20. If it's 50, then it should be also 50. Please keep in mind that same quantity of reagent should be, same quantity of distilled water should be added into the reagent blank. Understood? And we are using the terminology that is reagent blank. Means there should be reagent and should not be present any kinds of another particle. Okay, and please keep in mind that that is reagent blank. Okay, see here, that is the blank or that is the 1 ml. Understood? 1 ml of reagent you have to add it into the standard, there should be 1 ml. Into the test there should be 1 ml. After that, into the standard condition or into the standard condition, there should be 20 microliter of standard into the standard tube, and into the test tube there should be 20 microliter of test. Here should be another box that is a blank. Into the blank there should be 20 microliter of distilled water, right? And here should be blank, here should be blank. Understood?
yes,
Up
sir.
to this much understood? Okay, very much fine. After that, you have to mix it and incubate it for 5 degrees, 5 minutes, 37 degrees centigrade, or 10 minutes to 20 to 25 degrees centigrade. 20 to 25 degrees centigrade, it is a room temperature, and it is the temperature of incubator. Into the incubator, there should be 37 degrees centigrade temperature. Anyone can say me why we are fixing as well as why we are setting the 37 degrees centigrade temperature for incubation?
So that
Anyone?
it can mix it properly, the reagent with the sample, no?
Okay, okay. Can we use 30 degrees centigrade? Can you use
Oh,
40 degrees
30,
centigrade?
no, 37 room temperature.
37 not room temperature. Room temperature is 20 to 25.
Then,
37 degrees temperature is our body temperature. Getting my point?
okay, sir.
37 degree we are choosing these questions are always askable question into your interview. There might be we can choose the any other temperature, but 37 degree why? Then you have to say that 37 degree our body temperature. Okay, our body temperature is 37 degrees centigrade, so that incubation defining that you have to grow up this kinds of reagent as well as this kinds of reaction. Incubation defining that you are creating the environment to doing the reaction, that is called incubation. So that into the microbiology section, into the bacterial carbon, whenever we are growing any kinds of bacteria or any kinds of microbes, there is also required 37 degrees centigrade for their growing. Why? Because we have to understand that into this temperature, if they are growing into the incubation, they can also grow into our whole body. Yes or no? So that we are choosing the 37 degrees centigrade temperature for our incubation. But what year open, their temperature should be 60 degrees centigrade or above. Okay, what year open is the sterilization process as well as or dry heat sterilization. Example is hot air oven. Understood? And 37 degree or incubation or incubator temperature we are choosing only for our temperature is 37 degrees centigrade, so that if the bacteria are growing or if any kinds of reaction are happening within this 37 degrees centigrade, this reaction might be happening into our body as well. Okay, into the human body, so that we are choosing 37 degrees centigrade. Everyone understood?
Yes,
Everyone
sir.
understood?
Yes, sir.
স্যার একবার বলুন
Okay,
স্যার
so which portion you want
এই
to understand?
প্রসিডিওরটা একবার বলবেন
Procedure means you have to take 3 test tube. Okay, you have to take 3
হ্যাঁ
test tube. Okay, 1, 2, and 3. One test tube you have to give the name B for blank. Another test tube you have to give the name T for test. Another test tube you have to give the name standard. Okay, blank test standard. So that into the blank test tube you have to giving the this reagent 1 ml. Into the test tube you have to give the reagent 1 ml. And into the standard test tube you have to give the reagent 1 ml. Understood? Every test tube you have to give the reagent 1 ml. This reagent. Okay. After that you have to give. After that you have to give the into the blank test tube 20 microliter of distilled water. Into the test tube there should be 20 microliter of serum, and into the standard test tube there should be 20 microliter of this standard. Okay. After that incubate it 5 minutes into 37 degrees centigrade. Okay. And after that you have to taking the result as well as taking the absorbance. Okay. Against the
Okay, sir.
reagent one.
Okay.
Understood?
Yes, sir.
So that here is the reagent. See here. Here is the reagent. That is the enzyme reagent uricase. Getting my point? So that here should be three kinds of reagent. One is buffer reagent, and another one is the enzyme reagent, and another one is the uric acid standard. Okay. That is the uricase or PEB method. See here, uricase method. Keep in mind that uricase method. Okay. And that is a see here, that is a uric acid standard. Okay. This standard might be different into the different type of kit. That is depend upon the kit as well as that is depend upon the reagent box. Okay. And which kind of reagent you have to purchase, you have to just mention here, as well as you have to maintain this one. Okay. Understood? Understood?
Yes, sir.
Okay. Procedure, any kinds of doubt? After that, into the automated procedure, here does not require any kinds of reagent preparation, right? That is depend upon the machines, in which machines you are doing the test. Just do one thing, that just you have to putting the sample, as well as you have to set the standard. After that you have to just click here which kind of test you want to do. You can also do various type of parameter within a single click. Okay. Within the one blood sample or within one serum sample, you can do lots of parameter as well. Okay. After that, if I am coming to the calculation section, see absorbance of the od of test, right? Od of test defining by od of standard, right, into concentration of standard. Yes or no? And what is the concentration of the standard? Here we have understood that is 6, right? That is 6, right? So that you have to just doing the calculation into this methodology. Okay. The calculation part is same for every kinds of test, but you have to changes the test name only. Observation or optical density or observation of test defining and divided by observation of standard into concentration of standard. Please keep in mind that. Please keep in mind that. Okay. That is the calculation. After that, unit conversion unit. See here, that is the mg per dl. If you are taking the result in mg per dl into 59.48, if you are getting giving, if you are just multiply by 59.48, you can getting the result in micromole per liter. Okay. But there might be whenever you will do, there might be also into this unit, there might be some kinds of result, so that you have to give this one. Okay. If you are converting the mg per dl, you have to just multiply 59.48. Okay. You have to just multiply it 59.48, and you will get the proper result into the another unit, that is micromole per liter. That is micromole per liter. Understood? Same, everyone understood?
Yes, sir.
Okay. Up to this much, any kinds of doubt? Anyone facing any kinds of doubt up to this much? Anyone facing any kinds of doubt up to this much?
ক্যালকুলেশনটা একবার বলুন না।
OD, optical density of test, divided by optical density of standard, multiply concentration of standard. Okay, Tohiba? Understood?
Yes, sir.
Okay.
I got point, sir.
Okay, okay, fine, fine, fine. Now we are understanding the normal range. If you are seeing here the normal range for men 3.5, so that if you are calculating here, Tohiba, are you remembering these things? 0.7 to 1.4. Yes or no? 0.7 to 1.4, that is the normal range of creatinine, right? And
Yes,
here,
sir.
if you are noticing there, 3.5, just multiply it 3.5 into multiply, just double it, and you will get 3.5 to 7 mg per dl. Okay,
Yes, sir.
3.5 to 7. That is mg per dl. That is the normal range of uric acid. After that, if you are noticing here, that is the into the omen 2.4 to 60 mg per dl. Understood? 2.4 to 60 mg per dl. Understood? Okay. Okay, and this 1 ml basically formed by this enzymatic as well as the buffer. You have to mix 50 microliter of uric acid, the enzyme reagent, and 50 microliter of buffer. Okay, and both you have to mix, and then you will get the 1 ml. Understood? So that L1 is the buffer reagent and L2 is the enzymatic reagent. Okay. Okay, so that please listen here. We have understood the normal range of the men and women, and whenever it become elevated, it defining the various type of complication are occurring. That might be kidney failure, that might be the disorder related to kidney, that might be the related disorder related to joint, that might be any other pain or redness. Understood? Everyone understood?
Yes, sir.
Okay, so that same uric acid are found in urine or not? We can find the uric acid into our urine, yes or no?
Yes, sir.
Yes, sir. Found
Yes.
it.
Why Well, rather than uric acid, which kinds of another component we might found in urine also?
Urea, creatinine.
Urea, creatinine, very good. They are also finding in urine, right? Can
Yes, sir.
anyone tell me two cast name which is found into the urine? Cast, two cast or crystal name?
Granular cast, hyaline cast, cellular cast.
Very good. Uric acid crystal, have you listened the term uric acid crystal? Have you listened the term uric acid crystal? That is looking like this one, uric acid crystal. Yes or no? Have you
Yes,
Yes, sir.
listened
sir.
Yeah, yeah,
uric
yeah,
acid
yes, sir.
crystal? And another one is a triple phosphate crystal. The triple phosphate crystal are looking like that. Triple phosphate. Are you understanding the thing? Triple phosphate crystal. That is the uric acid crystal. Okay. 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 See here. So that into the urine 250 to 750 mg per 24 hour. 24 hour, within the 24 hour, these kinds of uric acid we might found into the urine. Okay. Now we are understanding the clinical significance. Please keep in mind that up to this much, if you are understanding, then I will discuss this important things. Here is every line are causing the question. From every line we can ask the question. Up to this much, anyone facing any kinds of problem? Up to this much, anyone facing any kinds of problem?
No, sir.
No. Okay. Now we are understanding the clinical significance. So that whatever we have understood, that we have understood what is uric acid, right? We have understood that what are the purpose of uric acid. We have understood the what is the principle of uric acid. Principle means how it's happening. Uric acid plus H2O basically forming the allantoin. See here, forming the C. See, allantoin plus H2O2, hydrogen peroxide. This hydrogen peroxide plus 4-aminotryptophan plus phenolic compound basically form the quinamine dye as well as H2O. Yes or no? And that is the principle we have understood, right? Principle we have understood, purpose, principle, and another P. These three P we are understanding daily. One is purpose, means why we will do. Another one is the principle, means how it's occurring, and another one is the procedure, what is the methodology. And after that we have understood the normal range. Now it's the last thing we need to understand, that is the clinical significance, means whenever it's elevated, which kind of problem might be occurred. Okay, and we are going to understand these things. See, if you are noticing the clinical significance of uric acid, see, that is the end product of urine metabolism, yes or no? is the one of the most component of the non-protein nitrogen fraction of plasma. Most of the uric acid formation occurs in liver. Getting my point? Where it's forming in liver. Understood? The uric acid formation are occurring into where? Liver. See, and derived either from the ingested or endogenous nucleoprotein. After that, it's basically derived by the endogenous means which is present into our whole body nucleic acid. Understood? Approximately half of total uric acid is in the body is eliminated by the urinary excursion. Are you understanding the thing? Half of uric acid that should be eliminate, half of uric acid that should be eliminated or extracted out by the urine. Understood? And destruction in intestinal tract. Numerous disease, stress or physiologically condition are associated with the alteration of the serum uric acid concentration. So various type of another type of disease might be formed if uric acid concentration or if uric acid level become elevated. Serum uric acid are elevated in the gut. Getting my point? Gut means into the arthritis disorder involving either uric acid synthesis or excursion. Means if that might be two types of phenomena. Yes or no? Two types of phenomena. That is the purine breakdown become increases or excursion of uric acid might be not occurred. Getting my point? The purine breakdown become elevated, that might be occurred, and the this purine or this uric acid excursion are not happening properly, that might be occurred. Understood? This first one might be occurred and second one might be occurred. Getting my point? And the other common etiological hyperuricemia. What do you mean by hyperuricemia? Say me. What do you mean by hyperuricemia? Hyperuricemia means
Increase
hyper
of
means,
the
hyper means
uric acid.
elevated. Uricemia defining that uric acid. Yes or no? Hyper. Can you say me hypernatremia? What do you mean by hypernatremia? Sodium level become elevated. What do you mean by hyperkalemia? Potassium level become elevated. Understood? Please keep in mind that. See, hyperuricemia and hyperuremia defining that urea level become increases. Hyperuricemia defining that the uric acid level become elevated. Include the renal dysfunction means kidney are not working properly. Leukemia means blood cancer. Polythyroidism means thyroid level become elevated. Ketoacidosis means ketone body level become elevated. That might be toxic as well as that might be creating the disease into our body, that is the ketoacidosis. That might be glucose 6 phosphate deficiency, that might be list 9 syndrome, that might be decreased level of uric acid have been described in the renal tubular reabsorption absorption defect. If uric acid level become decreases, that is very rare. In every kinds of cases uric acid become elevated, but some kinds of cases the uric acid become decreases. Which condition? See, Hodgkin disease might be, that is the bronchogenic carcinoma might be occurred, severe hepatocellular disease might be occurred, and xanthonuria might be occurred. Understood? These kinds of whole disease, into this condition uric acid level become decreases, and into this condition uric acid level become increases. So that if I am sum upping these things into the hyperuricemia, renal dysfunction, then uric acid become elevated. Leukemia, uric acid become elevated. Polyhyperthyroidism, uric acid become elevated. Glucose 6 phosphate, uric acid level become elevated. Okay, and there have a certain type of condition where uric acid level become decreases. We need to understand it. Okay, if the renal absorption defect are happening, so that uric acid level, the uric acid are not absorbed into our body, so that uric acid are excursion of uric acid become elevated. Whenever the excursion are elevated, it might seem that the uric acid level into our body become decreases, right? And another one is the Hodgkin disease, that is also one type of disease. Carcinoma, bronchogenic carcinoma, that is also one type of cancer. Hepatocellular disease means our liver cells are not working properly, so that the digestion as well as the breakdown of the breakdown of the purine are not occurring properly. And whenever the breakdown are not occurring properly, then uric acid level become decreases. Yes or no? After that, gentha urea defining that whenever the uric acid are founding into your into your urine too much, xanthonuria. Whenever the uric acid are founding into your urine too much, that is the xanthonuria. Into this condition, uric acid level become decreases into our body. Okay, understood?
Yes, sir.
Everyone, just say me.
Yes, sir.
Anyone facing any kinds of doubt?